name is Christine White. I'm doing my research at the Molecular Pathology Lab at the Coombe Women and Infants University Hospital. I received an Irish Cancer Society scholarship for research that will be focused on looking at biomarkers to identify women at high risk of developing cervical cancer. The human papillomavirus is a very important factor in cervical cancer and is found in 99% of cases. We are looking at this as a marker to identify these women. It causes abnormal changes in the cells of the cervix that can lead on to development of cancer. It also increases a protein called P16 in cervical cancer cells, and these will act as a marker to the human papillomavirus infection. We're also looking at the effects of smoking in cervical cancer and the development and progression of the disease. Smoking reduces your immune system, so this makes it harder to fight off infection. This will allow infection with the HPV virus to persist, and it's a persistent infection that will cause these abnormalities in the cervix to develop onto cancer. I hope to achieve improved diagnosis options for women who have cervical precancer, and this will help doctors and clinicians when it comes to the follow-up of women who are at high risk. They can follow these up more closely, where women at low risk can remain in routine screening. And this is going to prevent over-aggressive treatment and lengthy follow-ups, and will reduce the cost of the health service provider. We start off by collecting samples from women coming in for a colposcopy at the clinic over in Holles Street Hospital. We collect a smear from them, which we'll use to detect the presence of the HPV virus and the P16 protein. We'll also collect a urine sample from them, and we'll use this to measure the levels of nicotine. And this will tell us if that person is a smoker, passive smoker or a non-smoker, and if there's any relationship in the infection and persistence of the infection with smoking. When I think of the Irish Cancer Society, I think of an organisation that's providing a top-class service in cancer research. And this research will help us learn about cancer, the development of it, and help in prevention, in reducing the rates of cancer and providing top-class care for cancer patients. Well, cancer research is very important. There's over 20,000 cases of cancer each year in Ireland. Cervical cancer is the second most common malignancy in women. This accounts for 180 cases of cancer each year. Research is highly important when it comes to finding out information on prevention, treatment and management of cancer. Cervical cancer is a preventable disease, so this is why research is so important, and I want to be part of this organisation that's working to combat cancer.